Come in.
Hi, Mrs. Ross. My name is Sarah. I'm going to be your nurse today. Do you mind verifying your name and date of birth for me?
Christina Ross, November 9th, 1995.
I'm going to go wash my hands. I'll be right back. Okay, I'm going to shut your curtain for privacy. Today I'll be doing a cardiorespiratory exam. It requires some light touching, me listening to your respiratory sounds, and your heart sounds. Is that okay?
Yes.
And do you feel safe and comfortable in the position that you're in?
Yes.
Okay. And do you know where you are?
Exam room.
Okay. Can you tell me what day of the week it is?
Thursday.
And who our current president is?
Donald Trump.
Okay. The patient is alert and conscious of place, date, and person. When inspecting your skin, I see no redness, no pallor. Skin is consistent to ethnicity. And then upon inspection, I see that your anterior and posterior diameter is lesser than the transverse diameter. I'm going to go ahead and start by watching your respiratory rate. Just by watching it, I'm going to watch it for 15 seconds, and I'm going to multiply that by 4, okay? To get an accurate respiratory rate. Just go ahead and breathe normal for me. Okay, and after 15 seconds, your respiratory rate is 17. When we multiply 17 by 4, we get a respiratory rate of 68. There were no accessory muscles being used, no coughing, and no abnormalities with the respiration rate. I'm going to go ahead and have you turn around. We're going to start with the posterior side. I'm going to go ahead and check for posterior chest expansion. I'm going to take a deep breath for me. Okay, I see the chest expands symmetrically. Next, I'm going to go ahead and check for tactile firmitas. I'm going to have you say 99 every time I touch, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile firmitas is even throughout. Next, I'm going to go ahead and listen to your 8 respiratory pulses in the back, okay? Just give me 1 second to adjust the lighting. Okay. You can go ahead and just take a deep breath for me each time. Okay, and posterior respirations are clear and no adventitious sounds were heard. I can go ahead and have you turn around now. We're going to do the same thing for the anterior side. The lighting's still good. It's a little dark. Okay, I'm going to go ahead and check for expansion on the anterior side. Take a deep breath in for me. Okay, the chest expands symmetrically. Now I'm going to go ahead and have you say 99 again for me, okay? We're going to check for, go ahead.
99, 99, 99, 99, 99.
Sorry.
99, 99, 99.
Okay, and tactile firmitas on the anterior side is even throughout. Now I'm going to go ahead and listen to your anterior respiratory pulses as well, okay? Just have you take a deep breath for me. Okay, and anterior respiration is clear and even throughout. I'm going to listen to your axillary respirations as well. If you just lift up one arm for me. Okay, same thing on this side. Okay, and axillary respirations were clear and even throughout as well. No additional sounds were heard. Now I'm going to go ahead and feel your carotid pulse. Okay. Your carotid pulse is a 2 plus bilaterally on both sides. Now I'm going to go ahead and listen. I'm just going to go ahead and have you take a deep breath for me and breathe out slowly, okay? Okay, no abnormalities in your carotid pulse. No bruits were heard. I'm going to go ahead and palpate your chest. Okay, and there were no thrills noted. Now I'm going to go ahead and listen to your heart sounds. We'll start with your aortic pulse, which is located at the second intercostal on the right sternal border. Moving over to your pulmonary, which is located at your second intercostal on the left sternal border. Okay, now we'll move down to your third intercostal, which is the Erb's point. Moving down to the fourth intercostal, which is the tricuspid on the left sternal border. Okay, now moving down to the mitral valve, which is located at the fifth intercostal space. Okay, and no extra heart sounds were heard, no murmurs were heard, or other sounds. And that's going to go ahead and conclude our cardiorespiratory exam. Do you have any other questions?
No.
Okay, here's all your belongings. I'm going to go wash my hands. Did you want your privacy curtain open or closed?
You can keep it closed.
All right, and just press your phone if you need anything.
Thank you.